Hey guys, welcome to Fun Learning. In this video, we are going to discuss about the subtalar joint. With no further delay, let's get started. Subtalar joint is basically an articulation between the talus and calcaneum. Hence, the subtalar joint is also known as talocalcaneal joint. This talocalcaneal joint is basically composed of three articulations, which are nothing but anterior articulation, middle articulation, and posterior articulation. First, let us discuss about the posterior articulation. Listen carefully. In posterior articulation, the concave facet is present at the talus, whereas convex facet is present at the calcaneum. The exact reverse of it occur in the anterior and middle articulation, where convex is on the talus and concave facet is on the calcaneum. Okay, if you remember one, you can remember the other. Okay, so here in between this, that is in between the anterior, middle and posterior, we have a tunnel present over here. This tunnel is known as tarsal canal. Okay, so in between posterior articulation and anterior middle articulation, we have a tunnel. That tunnel is known as tarsal canal, via which the ligament and tendon passes through. Okay, so this tarsal canal has a large end and small end. Okay, its large end lies just anterior to the fibular malleoli, whereas its small end lie posterior to tibial malleoli and above the sustentaculum thalli. So large end lies anterior to fibular, small end lie posterior to tibial malleoli. Okay, as I said, this canal is present in between posterior articulation and anterior middle articulation. This separates the posterior articulation from anterior and middle articulation. Okay, thus this canal divides the posterior from anterior and middle articulation into two different non-communicating joint cavity. Hence, the posterior articulation has its own capsule, whereas the anterior and middle articulation share a capsule with the talonavicular joint. And you have to remember one more important point. The posterior articulation has a larger surface area when compared to the anterior and middle articulation. Thus, the posterior articulation receives 75% of the force transmitted through the subtalar joint. It was determined that the pressure in the posterior facet was similar to that at the middle and anterior facet. So, what I am trying to say here is, posterior facet oda contact area பெருசா இருக்கிறதுனால அதுல அந்த ஒரு facetல போகக்கூடிய force or pressure is equal to the pressure which goes in the anterior and middle articulation. Okay, now let us discuss about the ligaments of subtalar joint. So here we have calcaneofibular ligament, lateral talocalcaneal ligament, cervical ligament. As the name suggests, this ligament connects the neck of talus to the neck of calcaneum. Interosseous talocalcaneal ligament. So we have four ligaments, which are nothing but calcaneofibular, lateral talocalcaneal, cervical ligament, interosseous talocalcaneal ligament. Now let us discuss about the subtalar axis. This subtalar axis is somewhat oblique in nature, which is inclined 42 degree upward and anteriorly from the transverse plane and inclined medially 16 degree from sagittal plane. Okay, thus at the subtalar joint we have pronation and supination, which is a combination of abduction, adduction, inversion, eversion, and plantar flexion or dorsiflexion. Okay, the subtalar axis is inclined only very slightly towards the coronal axis. Therefore, pronation and supination only has a small component of dorsiflexion and plantar flexion. Now, let us discuss about the pronation and supination in detail. So, first, let us discuss about the non-weight bearing supination and pronation eppadi nadakudhu appdin sollitu. Now, everyone sit down. Okay, your foot should not be on the ground. So remember, this is a foot. Okay, wow. So supination is like this, whereas pronation is like this. Okay. Now your foot is in neutral. Now everyone supinate your foot. So what happens is, during supination, there will be calcaneum में adduction, inversion and plantar flexion occur. So during supination, calcaneum bone undergoes adduction, inversion and plantar flexion. Okay, va? So you are sitting, just do like this. Okay, adduction, inversion and plantar flexion. During pronation में calcaneum undergoes abduction, eversion and dorsiflexion. This is what occur in non-weight bearing. Now let us discuss about the weight bearing subtalar joint motion. So during weight bearing, what happens? Your calcaneum can undergo either inversion or eversion. It cannot undergo abduction or dorsiflexion, plantar flexion. So instead of calcaneum, the abduction and the adduction, the plantar flexion, dorsiflexion will be taken by the talus. Okay, va? So during weight bearing, supination may same. So non-weight bearing may we saw during supination may calcaneum undergo inversion, right? Whereas adduction and plantar flexion occur during supination. Inversion remains the same even in weight bearing, but during supination, your talus undergo abduction and your talus undergo dorsiflexion. Okay, va? Same in weight bearing, pronation may your calcaneum undergo eversion. This remains the same. Whereas your talus undergo adduction and plantar flexion. Okay, easy. Okay, va? When the subtalar joint supinate in a weight bearing position, the coupled component of talar abduction rotates the martis laterally, thus producing the lateral rotation of leg. So what they are trying to say, during weight bearing, your talus moves, right? So your talus take part in the ankle joint. So whenever the talus abduct during supination, there will be lateral rotation of the leg. அதே மாதிரி whenever talus adduct, there will be medial rotation of the leg. Okay, va? அப்போ weight bearing may there will be, whenever abduction occur, there will be lateral rotation of leg. Whenever adduction of talus occur, there will be medial rotation of leg. Okay, so range of subtalar motion. The calcaneal inversion and eversion component of subtalar motion can be measured in both weight bearing and non-weight bearing position by using, I'll show a video. I hope so that you can see this diagram. So in order to measure the calcaneal inversion and eversion, the reference line is nothing but a posterior line that passes through the leg and the posterior part of the calcaneum. Okay, wow. So during neutral, that is when your leg is neutral, there will be no angle formed between these two. That is the posterior midline of leg and the posterior calcaneum. Okay, wow. This condition is known as subtalar neutral. So whenever your leg goes for pronation, what happens? The angle will be formed between the posterior midline of the leg and the posterior calcaneum. The same occur in supination also. Okay, va? The 5 to 10 degree of calcaneal eversion is possible. The 20 to 30 degree of calcaneal inversion is possible. However, the talus motion are very difficult to measure. Estimate of talar abduction adduction have been made by measuring the tibial rotation that is accompanied during the abduction or adduction of talus in weight bearing. Okay. Now we have to remember one more important point. In supination, the ligament draws the subtalar joint surface together. Thus, supination is considered to be the close packed position. Whereas during pronation, the spreading of the adjacent tarsal bone permits some intertarsal mobility. Hence, the pronation is referred to as the loose packed position. Okay, va? So, supination is considered to be the close packed position, whereas pronation is considered to be a loose packed position.